more recently, and that is, should you wear a mask or not? Please like, please share this video so that we all can get this information. So I'm a board certified endocrinologist, so I treat patients who have diabetes and other hormonal conditions. And the COVID-19 pandemic is affecting my patients quite a bit because diabetes has been shown to be one of those risk factors that are leading to more severe outcomes. People are getting really ill, they're actually dying. Recent data coming out of Louisiana showed that 41% of patients who passed away from COVID-19 had diabetes. So if you have one of those high-risk conditions, diabetes, hypertension, chronic lung disease like asthma, chronic kidney disease, then let's talk about if you should wear a mask. Please, when you hop on, say hi so that I can see you. So this is an N95 mask. This is what it looks like. And this is what your healthcare workers actually need right now. This is what we have been petitioning for and demanding that we get this personal protective equipment. So let's talk a little bit about COVID-19 and how it spreads. So COVID-19 is spread by droplets. So when someone coughs or sneezes, they expel. Hi, Shirley, thank you for watching. When someone coughs or sneezes, they basically expel the virus out in some moisture droplets. And the droplets can't travel more than 6 feet. That's why they say you should stand at least 6 feet away from other people. So usually with droplets, in terms of the size of the droplets, it's usually more than 5 microns. However, when you go to the doctor or go to the hospital and you have to get intubated, or maybe you have to get a nebulizer treatment, and they're not doing that nebulizer treatment anymore for asthmatics. When you get intubated or get a nebulizer treatment, the droplets are actually aerosolized, so they actually become really small. So like I said, droplets are usually over 5 microns. The aerosols are usually under 5 microns. So how do the masks provide protection? So these N95 masks, the reason why they're called N95 masks is because they filter out 95% of particles that are under 3 microns. So this is what your healthcare worker needs when they're doing those procedures, like I mentioned before, intubation, as well as nebulization. And I'm sure there are other procedures, surgery, intra-abdominal surgeries, I was told lead to aerosolization of these particles as well. So these N95 masks, they're like gold to us right now. So I've seen people walking their dog in the grocery store with these masks. I guess if you already have one, you should probably wear it. But if you don't have one, please leave these for your healthcare workers. They're the ones that are basically putting themselves at risk when they intubate your relatives. So leave this for the healthcare workers. What about surgical masks? So surgical masks can give some protection, but not as much as the N95. They don't filter out as many particles as the N95 mask does. Also, these N95 masks need to be fit for you. So as physicians, once a year, we have to undergo a fit test to make sure that they fit snugly. So you might not even be having the right size. I'm actually going to show a graphic that I found on the CDC website, and it's the print is a little bit small, so I'm going to look on my phone to go over this. So this looks at the difference between a surgical mask and an N95 respirator. And like I said, the surgical mask is loose fitting, so therefore you can get viruses going all in between the corners of the mask. Also, if I'm wearing a surgical mask, and I cough, yes, it's going to prevent most of my droplets from coming out, but some can still escape around the sides. So the respirator is tight fitting. I wore this to see a patient last week and I could hardly breathe. Talking was difficult. So just pray for your doctors who have to wear these masks for 8-12 hours a day. So the surgical mask does not require a fit testing. The N95 respirator does require fit testing to make sure that it's tightly sealed, to make sure that you are in good health to be able to even wear this. In terms of filtration, the N95 mask, like I said earlier, filters out at least 95% of airborne particles, including large and small particles. However, the surgical mask does not provide the wearer with a reliable level of protection from inhaling smaller airborne particles, and it's not considered respiratory protection. So what does that mean? That means that if you have a surgical mask on, and I know the CDC keeps changing the recommendations. Initially, they were like, don't buy a mask, don't wear a mask. Now they're saying perhaps we should all wear a mask. They even have up on the CDC how you can make your own cloth mask at home. So I don't want you guys to have a false sense of protection, saying that, if I have a mask on, I can go and talk to people or go hug up people. No, these masks are not protective. They're not protecting you if you're wearing it. The masks are only protecting other people from you if you have COVID-19. So what we found is that there are a lot of asymptomatic carriers. What does that mean? That means that you're not coughing, you're not sneezing, so you're not propelling those droplets, but you're still infecting other people. Perhaps when we talk, when we sing, when we laugh, we release droplets, maybe not as much as if you were coughing or sneezing. So wearing the surgical mask, wearing the N95 mask, if you already have one, wearing the cloth mask, the goal of that is to try to stop your droplets from coming out. So I think this would all work best if we all wore a mask, because if I was infected and I wore a mask, that would stop me from spreading the infection. If Dr. Yara or Nicole were infected and they wore a mask, it would stop them from spreading COVID-19 as well. But even if you wear a mask, still maintain that 6 feet social distancing, still wash your hands, still don't touch your face. It makes no sense you putting on like I saw, so my engine light came on, so I had to go to the car dealership to get my car serviced. I didn't want to go, but I have to drive to and from work, so I had to get my car serviced. And I saw this woman, and she had a surgical mask on, and she had gloves on. So I sat and I watched her clean off the chair that she sat in. She cleaned off the table next to her with some Lysol wipes with her gloves, but she did not take the gloves off after that. She touched her face with the gloves. She pulled the mask with her gloves. She was playing on her phone with the gloves, and she was touching her bag. After a while, I said, "Hey, ma'am, I'm a doctor. Just want to let you know that if you decide to, clean off the surfaces, you probably should change the gloves after and use different gloves." And she got up and went and trashed the gloves. But yes, yeah, Dr. Yara, I was like, you are defeating the purpose. So that's the same thing with these masks, N95 masks, or even the surgical masks, or even the cloth masks. If you are someone that that if you have this mask on your face, you're going to be pulling at it and adjusting it, that might not be a good idea for you. Just be mindful. If you do have this mask on, don't be adjusting it and pulling it, because you are spreading whatever germs and viruses you have on your hands onto your face. The viruses will get through your eyes, your nose, and your mouth. So if you're constantly touching your nose, you're defeating the purpose. I know that these guidelines constantly change. When I first came on 4 weeks ago, I was saying don't wear a mask. Now, we're changing our tune because this is a novel coronavirus, and it's called novel because it's new, and we don't know as we go along, we're learning new things about how it's spread. We're learning new things about protection. So things might change again in the future, but I just wanted to come on and just share some knowledge about the mask. Like I said, overall, if you have one already, probably best to wear it. Don't be pulling at it too much. Don't be cleaning stuff off with gloves and then touching your face with gloves. Please, if you don't have one of these, don't go out and buy one. Leave these for the doctors who are intubating your relatives, who are intubating your friends. Leave these for the healthcare workers that are putting their lives on the line right now. Like, they're the ones that are in contact with the aerosols, with the really small particles. And I'm getting a little bit emotional about this because there are doctors who are dying right now because they don't have these. If you already have one, wear one, but if you don't, just leave them, as well as the surgical mask for the healthcare workers. Please drop any questions that you have in the chat, and I will come back and and answer it. Sorry. Like the video, share the video. You can follow me on all social media handles at Dr. Kelly Wood, MD, and that's DrKellywOodMD. I know you see lots of things floating around on WhatsApp, on Facebook groups about 5G and about, if you blow dry your nose hairs, you're going to kill coronavirus, or if you boil some garlic and inhale it, put your head over it and inhale it, you're going to cure coronavirus. And the reason why I'm coming on is because just to dispel a lot of those myths that we're hearing out there and to really give some factual information. Anyways, enjoy the rest of your Sunday.